And with us is Dr. George Thomas. Dr. Thomas, thank you for joining us today.
Thank you for coming.
Dr. Thomas, as a cardiologist, we'd like to talk today with you about some of the issues facing people and their heart conditions. Let's start before the heart attack, where someone, let's say they have a family history of heart disease. So they think, I need to have regular checkups. What are you looking for? And when should someone begin to have regular checkups?
Well, I think if you have a family history of heart disease, they should start paying attention early in life. That's the key thing. The atherosclerosis, the heart problem, does not begin at the age of 40 or 50 or 60. They manifested in the 40s or 50s or 60s, but the process began much earlier. We have found studies in people in their 20s with the atherosclerosis. They don't have bad blockage, but they do have it. So I would recommend them beginning their evaluation, especially with family history. Say, for example, in their 20s, they should measure their cholesterol, their blood lipids. They should start checking the blood pressure early on. Then they should pay attention to their weight and exercise. Maintaining a good weight and daily exercise is going to be so much protective. They don't have to follow the fate of their dad or their mom. I mean, people say my dad died at 40 or 38, but the son doesn't have to follow that track. There's a lot of things he can do today to prevent that. He can live much longer and normal life. Today we can do that. And I would say anybody with a family history or without even family history, they should pay attention to their cholesterol, blood pressure, weight, exercise, diet. And then maybe if they are 40, around that time, most people will recommend taking an aspirin, baby aspirin, if they can tolerate that.
We hear about good cholesterol and bad cholesterol. When we talk about the foods, there are some foods that impact the bad cholesterol, LDLs. There are some food that impact the good cholesterol,
right,
HDLs. Right. What exactly is the difference between the two?
As I said, cholesterol is lipids or fats in the blood. They are all carried in what we call lipoproteins. These fats are combined with the protein, and that's the way it is carried in the blood. We call it lipoproteins. The total cholesterol alone will not give you the total picture. There is what we call LDL, which stands for low density lipoprotein, which is more atherogenic, meaning more likely to cause hardening of the artery or atherosclerosis of your artery. That's why we call it bad cholesterol. LDL standing for low density lipoprotein. When we eat saturated fat, we tend to raise that LDL or low density lipoprotein. The higher the level of the LDL, we know clearly today, the higher the chance of a atherosclerosis or a heart attack. Now, there is another lipoprotein which is HDL, high density lipoprotein, HDL, which is like a scavenger. Just imagine nobody comes and picks up garbage for 2 weeks or for a week. Now this lipoprotein is what removes the excess fat from the periphery and brings it back to the liver and disposes it off. So here we have a balance. Suppose we have more good cholesterol, then there is a counterbalance or a counteraction to this bad cholesterol. So there is a group of people with perhaps mild elevation of bad cholesterol, LDL, but very low good cholesterol. So that is, having a low levels of good cholesterol is not good. That's a risk factor by itself. So if you have low levels of good cholesterol, that can lead to atherosclerosis. So when you look at the the different kinds of cholesterol abnormalities. One group have simply high levels of bad cholesterol, maybe normal or near normal HDL, which is a good cholesterol. There may be other group with not too high cholesterol, but yet they may have very low levels of protective cholesterol, which is the HDL.
Well, Dr. Thomas, I want to thank you very much for taking time out of your very busy schedule and being with us today.
You're very welcome.